A Kansas City infertility specialist is now saying a bioengineering breakthrough may be the holy grail to restoring human fertility. KCTV5's Abigael Jaymes explains the research that may bring the hope some women are looking for when it comes to getting pregnant.
A group of both engineers and biologists came together to create a 3D printed ovary. They were then able to restore fertility to mice unable to have babies, something they hope can also be done for humans. Having trouble getting pregnant can be frustrating and depressing.
Can be emotional at times when you see friends and other people having babies so easily, and you're kind of like, well, what's wrong with me?
For Katie and Tim Phelps, the reality was also real.
We wanted to have children and we were just trying to figure out how to get there.
After searching for an answer, they decided to try IVF. Later, the Phelps welcomed their twin boys, Joshua and Michael.
We never anticipated that, that it would take as long as it took and as hard as it was.
According to infertility specialist Dr. Ryan Riggs, almost 1 in 6 couples face infertility.
I always tell my patients, if you're at a Chiefs game or a Royals game, or you're down at the Sprint Center and you walk by 6 couples, one of them has infertility. So you're definitely not alone.
Riggs says infertility in women is linked to a number of causes, including cancer treatment, genetic diseases, and early menopause. He says in these cases, essentially the ovaries which produce and release eggs stop working. He cites egg health as a significant reason women struggle with infertility.
If a patient's not ovulating, we can give them medication to help them ovulate. But you know what we can't fix? We can't truly address the fundamental issue of bad eggs.
Though now a new study by the Northwestern University Feinberg School of Medicine and McCormick School of Engineering has the potential to address that problem. Researchers successfully created a gelatin scaffold of an ovary they made with 3D technology.
And then populated that scaffolding with immature mouse eggs.
This scaffold was created with organic materials safe to use in humans.
And then they took mice, they removed the normal ovary, replaced that with the biosynthetic ovary and mated them and got healthy mouse pups.
The moms were even able to nurse their offspring, a breakthrough in technology that Riggs says can be the answer to those struggling with infertility.
The idea of a potential, if you will, egg transfusion being successful and taking that bioprosthetic ovary and putting it into a patient, that would potentially be one of the holy grails for treatment in the infertility world.
As for Katie and Tim Phelps, now that their twins are 3, they're hoping to have another child. Though due to more medical advancements, they'll be going a different route than the first time.
3 years later, Dr. Riggs tells us that he would have done it differently. We put 2 embryos in, and he says today he would only put 1 in because the odds are so much better with the technology today.
Now, Dr. Riggs says this breakthrough in technology probably won't happen for humans for another several years. However, when it does, he says it has the potential to impact millions. Abigael Jaymes, KCTV5 News.